just because of the stigma and the stress. And do you provide like services around smoking cessation, lung cancer screening? Even though I know at younger ages, screening is not as what's the word?
Prevalent. Yeah.
You know what I couldn't even figure it. Yes, but it tends to be later. But they tend to have higher incidence because of the earlier start times.
Yeah. So I will say that I always have anxiety when people reach out to me about smoking cessation programs, because we've tried to have them in the past and people just don't show up. Substance use, yes, we have support here with AA, but also with Smart Recovery, and Smart Recovery provides support for any and all addictions, whether it's substance, whether it's sex, whether it's spending, any across the spectrum. And we have recently had some additional interest from folks who are part of the community wanting to offer specific substance use recovery support at the center. And so we're having those conversations to see what would work, because anything that we implement, we want it to be long-term and sustainable. But we're also the kind of place where you can come here and we can try something, and if it doesn't work, we pivot and try something else, because you never know what might work. In terms of smoking cessation or any sort of cancer prevention screenings, we have a great partnership with the Gathering Place, where we collaborate often on programs. We also, every year in June, this year will be the third year, we do an event called Thrive with Pride as part of Pride Month, which is, one way in which we show our pride is by also taking pride in ourselves and the way that we care for ourselves. And so really it started in 2021 with really the goal of creating a culture of health and wellness at the center, but also that sort of permeates out into the community, and then also the Gordon Square community, which is where we are in our neighborhood, and wanting to really normalize and create a norm in our community that preventive care is good, it's easy, it's accessible. And so we partner with different providers that come to the table, and they offer all the services are free. We don't want anybody to leave and go home and get a surprise bill. And so we've been very grateful for the folks that have partnered with us to make that possible. We've had, the PAP van, I call it the PAP van, I don't know the proper name for it, but from UH, they have a mobile van where you have LGBT providers providing PAP smears, right? We have had the mobile breast cancer screening unit come out, and they've done breast mammograms. We've had Cleveland Clinic here doing preventive care, but what I've loved about working with them is that they have not only do they do a PSA draw for prostate cancer, but they're also doing the full blood work panel, right, at no cost to our community folks. So at least once a year, they're getting a full screen of their insulin levels, their cholesterol, some of the most commonly found chronic conditions, lung function tests, diabetes consultation, and getting connected to care if they need to monitor their condition. And then we also have other services that are here. So the homeless hookup comes with their mobile van, and they have a cookout outside, and they offer free haircuts and their clothing bank and their book bank. And B. Riley always shows up with several vans of their folks to be able to access these services, because they know that when they come to the center, they are not going to be dead named. They're not going to be misgendered. They're not going to have nurses or other frontline staff pick up the phone and call and say, and this has literally happened, hey, I got one of those trannies here. You want to come take a look? That has happened in a hospital multiple times when folks have gone to access emergency services, right? So you're in an emergency situation, and that has been the experience. And so, we are really, really proud and glad that we're able to create an environment that is safe, that's affirming, that normalizes taking care of one's self and caring for our health and our wellness in a more holistic way.
Thank you. Thank you,
Hi,
Gulnar.
Gulnar. As we're kind of talking about the LGBTQ Center and in general building like the scaffolding, like the not burden, but the power that community has in helping folks access appropriate healthcare. And you kind of sort of touch on this. I'm curious what kind of maybe challenge you have such a wide breadth of partners that you work with, and you get to create the environment in your space that is so supportive of folks that are seeking care. But I'm wondering what kind of work you might have to do on the front end with some of those partners to make sure that they aren't entering the space and then accidentally re-traumatizing or reharming folks that have been harmed in their spaces offsite. So I'm curious what kind of work starts. Yeah.
That's a really good question. And I would say that most of the key contacts, like our point people in those healthcare organizations, are part of their organization's Pride employee resource groups, right? So any of their LGBT or Pride ERGs, those are the folks that we have partnered with, and usually they are the ones that are volunteering their time. I will say that, the big challenge on the side of like healthcare organizations or any organizations is, even if they say they're nonprofit, they're still a profit making business, and healthcare is treated as a business, and yay capitalism, not really, but and so what happens is oftentimes the systems themselves are not willing to fund that person's time, and so sometimes they have to like volunteer their time or donate their time, which then also like turns into a barrier to access, right? Because not everybody has the privilege of being able to volunteer or donate their time. And so what we've been just very lucky, because, the groundwork has been done over the last, 10 years or so, that we've really sort of shifted our in terms of our programming and having like a more clarified focus on how we want to serve the community, is supporting those organizations in building those ERGs, in supporting those ERGs. Like we've had employees reach out and say, hey, I want to start an ERG at my organization. What can I do? How can I support? I would say that one of the best ways for organizations to make sure that they're not propagating harm is to get even basic LGBTQ 101 type of training, right? Like just even basic knowledge of the terms and terminology, and an understanding of like why pronouns matter. Something as, what we would consider in 2023 as something rudimentary and basic is still sometimes lacking in many organizations. And the barrier that we have found in terms of at a systems level across the healthcare system is an inherent resistance from the bureaucracy of those systems to want to bring in an external organization that has the expertise, that has the lived experience, to come in and offer training. When we have reached out, we've always been turned down. We've been told that, oh, y'all, we already have a DEI office. Our diversity person's going to do this training. It's great. Like they don't want to spend the money. The other thing they don't realize is that as a nonprofit, we are, just because we are a nonprofit doesn't mean that we can do things for free. We got to keep the lights on, and we got to pay our people. And that extractionist mentality of like, we're just going to extract from marginalized communities and take what we can get and walk away without any return is sort of what it drives that culture of like not wanting to pay for the education that is so badly needed. And so that's also been a challenge quite often.
Yeah, if I may, you're leading me to the next question then, right? So a lot of folks over here are researchers, they're in the research capacity, they may reach out, to do some projects with the center or seek information about the queer community, what is it that we truly, or you in this case, truly expect, when partners show up? What should they return to you with after they've done their research? What would you like to see from them?
Oh my God, I'm so glad you asked that question because I'm about to get on my soapbox. So over the last 4 years, we have really sort of focused in on honing and developing our internal process and developing a framework of how we want to partner with researchers. Research went from something being an ad hoc sort of component of the work that we did. And, if we were able to, we would be like, okay, yeah, sure, come on in and do the survey and do the focus groups, to being like, we had, and I will always give Dr. Misty Lumine this credit because she, through the CBRN that we were, hi Jackie, that we were funded for on a project, really created sort of what I considered the gold standard for how community-based research should be done. Like in my mind of like, I was like, okay, this is how we want to be moving forward, which is, don't come to me when you've already decided like this is the methodology and this is the research question and this is how we're going to do it. And you're just reaching out to me to help you recruit. Sorry, that is so antithetical to what it means to do research with the community and for the community and to really serve the community. Instead, we want to be brought in right at the beginning when you're designing the research and the study to really get input from the community as stakeholders around what is it that they want to know more about, what is it that they feel needs to be addressed, what are their concerns, and then partnering throughout the process in terms of, looking at the questions that are going to be asked, making sure that they're going to be asked the right way. At a basic minimum, all the researchers and staff that are going to be interacting with the community should receive LGBTQ cultural humility training. Bare basic minimum, right? And then in terms of once things are done, there should be some sort of closing of the loop. And I'm not talking about just like a dissemination day and here's what we learned, bam. That's not helpful to me. What's helpful to me is, okay, this is what we found. How do we use this to now serve the community? Right? Because we found something, we've learned something, but how do we actually translate that and apply that in service of the community? That for me is true dissemination of the knowledge. So if you are not ready to make that sort of commitment, then I'm going to sound really like an asshole, but I'm like, you got to reevaluate why you're in this business of doing the research in the first place, right? So I want us to move beyond the performative to the actual showing up and doing. I always say this, if you want to partner, you better have skin in the game, right? Because I want you to not be afraid to utilize the power and the privilege that you have as an institution or as a person of authority, whatever it is, to be able to utilize that to make changes, open up doors, and create space for our voices to be heard. Like, let's do this together. I don't want you to come in and say, hey, I have a survey, and I need this information. Okay, great. You can put your survey on Facebook, good luck. I need it to be a more meaningful partnership.
Beautiful. Did that bring up any questions or any thoughts in the room? So from researchers' perspectives, what else could we, offer the LGBT Center? How else can we be of service to them? Perhaps that's a question for us to grapple with.
Oh my gosh. I hope I didn't scare anybody away with my soapbox.
I think people are quiet, Gulnar. Yeah.
Because we truly do love to partner. And I would say one of our, when you think about organizations and we think about core competencies, I would say that one of our core competencies is collaboration. We are a really great community partner and to work with. We like to build trust. Transparency is what we lead with. And so you can expect a, reciprocal, mutually trust-based, transparent relationship. And so, in terms of how the community at large can support the center is key. First thing I always say is show up. Show up. Because then you'll get to know the community and the community will get to know you. And that's like one of the basic building blocks of building trust with the community. Don't just show up for pride. We're gay 365 days a year, not just the 30 days of June, right? So let's move beyond this rainbow capitalism and this rainbow washing that happens, because all of that is for your bottom line. It's not for ours. And so,
Yeah.
Go ahead, Gulnar.
Oh, okay. I thought somebody had a question. The other piece I would say is, so show up. Don't be afraid to have skin in the game and speak out. Like we're seeing this environment where there is just increasing anti-LGBT sentiment, rhetoric, targeting especially of our trans and gender diverse siblings. There are real risks here of access to healthcare being cut off for those that are most vulnerable, our children in the healthcare system. There's increasing risk of neglect and medical violence towards our community. And so we've been talking about this for decades and years, but the larger community needs to mobilize with us so that we can have a louder voice. And I would say that, advocate for your organizations in whatever way you can to be more inclusive, to get training. It doesn't have to be from us, right? There's lots of organizations that offer this, cultural humility training, but just make sure that you're advocating for cultural change in your own spaces, because that's going to drive the larger cultural change at a societal level, which is what we really need. And vote. Voting matters, right? Voting matters.
Right on that front, Gulnar, we know more and more that democracy building is related to health as well. Are you programming in that regard on voting and democracy building?
Yeah, so we have to be a little bit careful in how much we can do because of our nonprofit status. But yes, we partner with organizations to do voter education. We actually just started a life skills development program for young queer folk ages 14 to 24. And one of the 9 modules that's going to be covered is a workshop on civic engagement. Like we felt that it was very important to build that in. And then, we will periodically have Equality Ohio in here, Honesty for Ohio Education to come in and do, just education on the different bills and the legislation and how people can advocate and how people get involved. You can see some of our community forums, like they've been recorded and posted on our website. And so we hold those community forums. We show up down in Columbus to protest and to give testimony. We partner with the Ohio Women's, the Women's Voter, a League of Women Voters. That's what it is. So the League of Women Voters, Cleveland Votes, Black Lives Matters. Like we do a lot of cross collaboration, and a really great example of how that all comes together in a bigger sense is at Pride, where we have the Speak Out stage, which is this separate from the main stage, but is the stage specifically for activism and for folks to deliver any social messaging that they want to deliver. And so that is open to anybody in the community. Anybody can sign up for a 5-minute spot to say, like, get their message out. We've worked with Ohio Poor People's Campaign that have, been on that spot, Planned Parenthood, abortion rights, reproductive rights, Red Triangle, the whole gamut, like across the board.
So we can really see how the LGBT Center is doing a fantastic job in providing scaffolding for, folks that are being missed by the larger systems. And I'm wondering if anyone in the room has some thoughts about how can the larger systems actually step up to decrease the load on the LGBT Center, or how can they be supportive of the center itself? What do we think?
Can I just say something real quick? I just had this thought of, like, another way to support is to recognize that, I did a search yesterday. I was looking for senior programs in Cuyahoga County, and I found 75 different senior centers just in Cuyahoga County, 75. None of them are like specifically serving the LGBT community, right? The LGBT Center is the only senior serving program for serving LGBTQ seniors. And, this notion that when you, the funding environment and the funding landscape, I think we need to do a better job of recognizing, like, funders are happy to fund rec centers. They're happy to fund community centers. Every neighborhood has a community center or a rec center. But for all of Northeast Ohio, there's one LGBT community center that's a physical space. And so when people come back to me and they say, well, you've got a pretty decent sized budget, and I'm like trying to tell them that how under-resourced we are, right? Because when you're okay with funding what you would consider duplicative services across neighborhoods, in every neighborhood, but then you don't want to fully fund the one place that is a physical space in all of Northeast Ohio for LGBTQ people, like, makes me question priorities and really makes me question the language that we've been hearing about, like shifting towards equitable funding. So I think that's, those are some simple facts that I feel like people can take and go advocate with.
Absolutely. It's coming. All right, so we have another 5 minutes remaining for our session. I'm curious if something's come up for the folks in the room, if you're thinking about how can we actually be more tangibly supportive to the LGBT Center, to minoritized communities in general. What comes up?
I have a little question as to, if you do not identify yourself as a male or a female, does that muck up your paperwork and getting medical care and other things and ... I expect it does, but I wondered if you could talk about that a little bit.
Yeah. Yes and no. I would say, like, first of all, just data gathering on our population is almost basically non-existent. And there's been no desire. Like, I have previously gone to a funder and said, like, hey, can you fund our rainbow, like our older adult program? And they've been like, yeah, but we don't really know the impact. And I'm like, okay, they're like, you have no data. So I'm like, okay, well, will you fund us to be able to get this data, right? Like, help us get a consultant, help us get a system onboarded. And they were like, yeah, we couldn't figure out how to connect the dots between like what you're asking for and what the impact might be. And I was like, yeah, really? But I share that example to sort of share like how that sort of attitudes permeates across even the healthcare system, right? Like, this data is not collected. Consistently, there have been some really great shifts recently around getting better at collecting SOGI data, sexual orientation and gender identity data. but you know, it's very problematic because it's not consistent. The way it's collected is not consistent across systems. So everybody's asking different types of questions in different ways. There's no sort of uniform standards for gathering this data. And so, yeah, it does have an impact. So if you don't disclose, like I was just having a conversation a couple of weeks ago with someone who participated in one of our research projects, and, you know, they pass as fully male. And, you know, so people don't even, so people assume that they're male, which is great for them, like, and they still need to get a PAP. You know, they still need to have, you know, pay attention to reproductive health because they still have parts and pieces of female reproductive organs, right? But they don't even get asked. There was another situation where, you know, a trans man was pregnant and going to have a baby, but because they didn't present as female when they went to the emergency room with some issues, like they did all the tests in the world, but they didn't check the chart. And if they had checked the chart, they would have known that this person is A, you know, was female assigned at birth, but B, more importantly, they would have known that this person is pregnant. And in that delay and all the wrong types of care being administered, that person lost their baby, which is, it's already a hard, tough journey as queer folk to have kids, right? You have to rely a lot on assistive reproductive services, which are not even covered oftentimes by insurance. So people are going out of pocket to be able to build a family. And then to experience that, it's just is so traumatizing, and the impact is just continues to be compounded. Now, you know, now that person is a person of color, and we already know the health outcomes for people of color in the medical system. But now if you're a person of color and you're trans and you don't have access to insurance and you don't have an affirming care provider, like literally you're fucked, right? Like you are literally fucked. Good luck. Like the fact that you get out alive from the hospital is like a big fucking deal.
Time's over, but thank you, Gulnar. That was fantastic. Really, really grateful for you for sharing all your wisdom, and yeah, thanks to the LGBT Center.
Thank you for being here. Thank you.
Thanks.